Assalamualaikum and a very good day to my audience and I be to my lecturer Miss Istiha. My name is Muhammad Shah Daniel and I am from UAE Gambang. Today I would like to express to you guys about the third SDG Sustainable Development Goals, which is good health and well-being, and how the Malaysian Medical Relief Society MERCY respond to solve this issue mentioned. Before that, I would like to ask you guys, do you know that there are still some people out there who still do not get a fair health services? In the healthcare setting, this manifests in the opinions, beliefs, behaviors, and also the attitudes of clinicians, significantly impacting certain disadvantaged populations. Well, to relate this, some people in certain places are unlucky due to not having the access to certain vaccine and a fair service, nor a fair price for the health cost service in their country, such as America. Thus, to achieve the dream, we must take the responsibility by empowering the health service in every country, so we could ensure everyone receive a fair chances to be vaccinated. It is the key for a good health in human well-being. Myself, always prioritize my physical and mental health rather than anything. I believe some people out there are still struggling to keep their physical and mental state at its best level. In fact, I had joined a few of charity and a non-government organization movement in empowering the public health rights to keep the locals in Malaysia healthy. So I made a thorough evaluation on this condition by relating it to the third SDG. In general, I would like to tell you guys how the third SDG could affect our life and how MERCY solve the issue that I will mention after this. Okay, let's move on to my next point, which is SDG 3 promise all public health service. Global Goal 3 is established by the United Nations in 2015. The official wording is ensure healthy lives and promote well-being for all at all ages. So the importance of good health and well-being is essential to a sustainable development. It focuses on broader economic and social inequality, urbanization, climate crisis, continuing burden of HIV, and other kind of infection diseases such as COVID-19. Having a strong and well-adapted sense of well-being can help us to overcome difficulties and help us achieve our goals in life. Next, the issues that lies under this SDG. The inequalities in health service are seen not just between, but also within the countries. For example, only 17% of mothers and children in the poorest field of household in low and lower middle income countries receive at least 6 of 7 basic maternal and child health interventions compared to 74% for the wealthiest fifth of the household. Having said that, I want to share with you about an organization that shows an effort in making sure all layers of people receive the rights of public health service. Discriminations and the way how the doctors and clinicians are now treating the patients due to their social status and rank are worrying in Malaysia. Just because they are poor, they have been treated very bad, very awful, because they do not have the right amount of money to be treated as like how the non-government places and hospitals are. This is very worrying, but don't you worry, because the MERCY in Malaysia efforts in solving issues in good health and well-being because it has been related to the SDG. The background of MERCY Malaysia as a non-profit organization is in 1999. Dr. Jamilah Mahmud, a Malaysian obstetrician and gynecologist, was moved to volunteer her medical services, where she established the Malaysian Medical Relief Society, better known today as Mercy Malaysia. Mercy Malaysia aimed to provide a platform for Malaysians to unite and play their role in the international humanitarian arena. In the last 2 decades, the organization has provided humanitarian assistance and also programs in 2 countries. That's a lot, right? In crisis and non-crisis situations too. Mercy Malaysia has also evolved into a full-fledged humanitarian organization offering the full spectrum of humanitarian services. The relation of Mercy Malaysia with the third SDG is where Mercy Malaysia initially focused on medical relief. Mercy Malaysia has also evolved through the years into a full-fledged humanitarian organization, one of the few operating in the global south. With that, Mercy Malaysia had a change in thinking in 2005 by adapting the Total Disaster Risk Management (TDRM) approach to their work. TDRM applies disaster risk management to all the phases of the disaster management cycle, from emergency response to recovery, prevention, mitigation, and preparedness and readiness. This is how the Mercy is related closest to the real definition of the third SDG, which is to ensure healthy lives and promote well-being for all ages. Now, let me tell you guys what is the contribution of Mercy Malaysia to the third SDG, which is through the Outreach Clinic projects. The objective of this project are remarkably close to the objective of the third SDG, which is to provide fair public health services for every layer of human being. This project objective included increases access to health and dental services among the rural communities, increase the level of awareness on reproductive health, and also help instill the importance of maintaining good hygiene practice in our lifestyle. This project successfully screened tons of people who did not receive the health service that they deserve. This project is related to the target 3.8 of the third SDG, which is to achieve universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. And by that saying, we as a person, we cannot ignore all the services of health. We must take care for those who are unlucky not to get what they deserve as a human right. This is why we have to empower the system of health in our country. We must know that each of a single human being have the right to get what they deserve, especially on human health services. After this, I hope you have a better understanding about good health and well-being, especially on the concept of fairness of health services towards everyone. So, I have enlightened everyone here about the third SDG Sustainable Development Goal, which is health and well-being, and how Mercy Malaysia responds to the issue mentioned. Our welfare and health services must work for everyone, ensuring all the help and support is wrapped around the person when they need it, not trying to make the person fit the system. I would like to quote a quote from Maya Angelou, a poet and an author. She once said, I quote, "They may forget your name, but they will never forget how you made them feel inside." And by that, thank you very much for watching.